Hey guys, Jim Hoffman here for EMS Office Hours, and this is your Monday Minutes. Okay, today just a quick little A&P session here for you. I want to just show you, talk about the radius and the ulna. I want to just sort of break this down a little bit though, to give you a better look at the bones themselves. And you know, these are sometimes we get often fractures, right, in the forearm, and I think it's important to note when we document what we think is broken on the patient, which bone it is, okay, or what side of the forearm it is, right? So the radius is the one that is on the lateral side, okay, but the thumb side, think of it that way. Think of it being on the thumb side of the patient when they're in an anatomical position, okay? That is where the radius is, okay? Now the ulna, of course, is on the inside, or it's on the pinky side, right, the little finger side. So that is where the bones sit inside of the forearm, okay? And it's sort of good to know this, guys, because when you're documenting, you know, for your paperwork and all, you can sort of, in your mind's eye, even though you can't look at an x-ray, you can see where the bones lie in your mind's eye for the patient. And this is good for your documentation, it's good for your patient reporting, okay? And also good as well, guys, when you think about, you ever just see that little bony process on the end here, right, of the patient? You get that small little bony protrusion there, and that's called the styloid process, and that's where all your ligaments get attached to the wrist. So the good part about sort of knowing that and recognizing that is that if you've got an injury there that isn't necessarily fractured, the patient may have some ligament damage, right? So if you see, you know, localized damage there, some localized injury there, you can consider that they might have some sort of ligament damage going on to that distal end there. Now the proximal end, you've got the, don't forget, you got the radial head, okay, on the proximal end of the radius, okay? Just some quick little overviews, guys. Nothing fancy here, but I just wanted you to sort of get a good look here at this and where these bones lie, okay, in relation to the forearm, in relation to the patient's hand and wrist and fingers, okay? So just get a good look here. You can get a good little picture of this, okay, to get a nice view of it, right? And again, I broke away a lot of the muscles and the nerves and tissues and stuff like that, just to give you a good little picture of it. So hopefully this will maybe give you a little bit of a better idea of what's going on and where these bones lie in the forearm. And instead of just sort of regurgitating back that the forearm bones is the radius and the ulna, you'll know that the radius is on the thumb side and that the ulna is on the pinky side or the little finger side. And don't forget about those ligaments where they're attaching at that little bony process there at the wrist area, the distal end of the bones, okay? All right, guys, that's pretty much it. Just quick Monday Minutes, just a little bit of a takeaway here, and I hope you can use these somehow. And the next time you get a patient that might have a fractured forearm, that you'll be able to document a little bit better and be able to give your patient report a little bit clearer. Guys, you have some information, some Monday Minutes of your own you want to share, be sure to send me an email. My email is admin@emssco.com. I'd be more than happy to put something you have or you find of interest here on the Monday Minutes weekly video cast here. So until next week, guys, as always, Jim Hoffman for EMS Office Hours. Stay safe.